Thank you very much, dear colleagues, Professor Hajar, President of this meeting, dear friends. It's always a pleasure to be with you every year in the hearing meeting, and especially this year in wonderful Dubai. You all, through talks every day with your patients, are well aware of the problems patients with disabling hearing loss face. And let me just repeat shortly what 500 million people in the world experience every day due to this disabling hearing loss. Next. Even. Well, first of all, patients with a hearing loss of more than 40 decibel, with a disabling hearing loss, have the stigma of being old. They have the stigma a little bit to be stupid. They feel ridiculized because they give wrong answers because they do not understand the question. They are erroneously suspected of mental retardation because they are doing things that are inappropriate due to the task they have to do because they didn't understand it. They try to avoid meetings with family, with friends, because they feel lonely amid a lot of noise through which they cannot understand good discussions. So they lose a little bit belonging. And so these patients try to avoid these situations, and they go into a kind of self-isolation. And this self-isolation also is joined with feelings of depression and anxiety, and also the stress of not understanding something and then doing what should not be done, or saying things that are not to the point at that moment. So that's really not a fun to have hearing loss. And apart from that, there's also the influence really on accelerated cognitive decline. The normal cognitive decline every one of us from a certain age will face, but it's accelerated with hearing loss if it is not treated appropriately with hearing aids of cochlear implantation. And we know that the more the hearing loss, the faster this acceleration. And also the longer this disability lasts, the more the quality of life is affected. And this is not all. Becoming deaf, having a hearing loss, is very expensive. It's very expensive for the person, and it's very expensive for society. And this is not only due to your fees, not only to the cost of the implants and the hearing devices. Now, the main cost results from underemployment, losing your job. About 1/3 of the people that acquire a severe to profound hearing loss will lose their job or retire early. And all this loss of productivity, early retirement, early shift to residential care, the 7% extra dementia due to hearing loss, all this amounts for Europe alone to more than 200 billion euros per year. So this is really expensive. You all know this. You all face these problems every day with patients. But outside this room, I would say there is a lack of awareness. The lack of awareness of the patients themselves. They are ashamed to come up with their problem. They realize late that they have a hearing loss that will bring them on this slippery slope of declining quality of life. You have the medical doctors, and also the primary healthcare providers. And they are the main influencers to motivate the patient to seek help. Also, they are not aware of the far-reaching consequences of hearing loss and what it means for their lives. And sometimes even they discourage people to wear a hearing aid. They say, oh, no, you are too young for a hearing aid. That we hear every day. And this is a pity. And just because they do not realize these consequences. And then there are the healthcare providers and the insurers that take priority of their budgets to oncology or to cardiology, but also unaware of the effect and the economic effect of hearing loss. And then there are the politicians and the policymakers, because they are important because they have the key to open the door to better hearing care. They also have to be convinced, and they have to be aware of these consequences on the society, and also to be aware that investing for €1 investment, you get 15 euros back in gain. But there is an inconvenient truth. This lack of awareness, part of it due to this lack of awareness, there is an underuse of the existing possibilities of restoring hearing and getting back the quality of life these patients deserve. And also, it also delays providing this report. And I give just 2 examples. The first one is a slide I got from our colleague Cernotte here that he used during his last meeting, successful meeting in Argentina on cochlear implantation and auditory implants for emerging countries. And the penetration of cochlear implantation of severe to profound hearing loss in neonates is only, in a number of countries, only 2%. 2%. And the other example is, because you say, well, these are emerging countries. Now I look at the high-income countries. For adults with acquired hearing loss, with severe to profound hearing loss, there's no country that gets above 10% of implantation. We are discussing about little steps and sometimes big steps in our technology, but there are 90% that even have no access to it or don't know that it might help them. For that reason, because you can complain, but you can also, well, we try to do something, we started the initiative from a network together with Hearing, MEDEL, and the patient association is the European Cochlear Implant Users, and this, maybe you've not heard about the European Cochlear Implant Users, but they had a very good conference by Professor Baumgartner this year in Vienna. Together, we started a network, and it is Patrick Daze from MEDEL, who is the main engine that lubricates the machinery behind it, like Peter Grasso for hearing. He's doing it for this Hearing Health Forum EU. And the mission is to raise this awareness and to strive and endorse this public patient-centered health strategy at the level of the EU and then also at the different member states. And it is the aim to expand also this model to other regions in the world. And it is to promote this awareness, but especially, of course, to promote that there are new laws and regulations that open this door to accessible hearing care. And in particular, that there is knowledge of this innovative technology of hearing auditory implants. And we made a manifesto, a document, after consulting many patient organizations and stakeholders, and the QR code gives you access to this document, this manifesto, and also the QR code will be outside this room during the coffee break so that you can get access to this document. And this document focuses on 4 pillars, and for convenience, we use them the HEAR pillars, the age from hearing loss awareness to educate the different levels, to reduce stigma, to promote inclusion, early prevention through screening, increasing and facilitate also access, also financing of the hearing care, and to support research that is directly focusing on endorsing policy making.